Question, sir. It's like.
No problem. Wait 2 minutes, please. Just a minute.
Hello, dear viewers. I'm Shailly Agarwal, your host for the evening, and I warmly welcome all of you to 10 Years Live. Hello, dear viewers. I'm Shailly Agarwal, your host for the day, and I warmly welcome all of you to 10 Years Live. In India, there's a very old saying that doctors are second to God on this earth. And it is because of the fact that besides God, if there's somebody who can, save the mankind from suffering, diseases, illnesses, and can give life, it is the doctors. But being a doctor is never easy. It requires a lot of effort, determination, and persistence. Yet, there is a section of people who have the courage to dream big and try hard. And when we talk about the medical profession, the medical field, we also need to address its evolution. From home remedies to trial and error to technology, and now we have the virtual care. And to talk about this today, we have with us someone very special. So please welcome our guest for the day, one of the most renowned gastroenterologists of Nagpur and also the first gastroenterologist of Vidarbha, Dr. Shrikant Mukewar, who is currently practicing as a consultant gastroenterologist at Midas Multi-Speciality Hospital, Nagpur. Welcome to 10 News, sir.
Hi, welcome. Good morning. Namaskar.
Hello, sir. Today we are really,
Hi.
we are really happy to have this pleasure on having you on our show. Yes, sir. To
Yeah, yeah.
begin
Thank
this,
you.
you are such a renowned and veteran medical professional. So, and you have completed your education in the early 1980s. So, what motivated you to become a gastroenterologist at a time when there was not much awareness about it?
Yeah, that's
Because
a
people
very interesting.
knew, yeah, yes,
Yeah, that's very interesting question. In fact, I must tell you that after getting a graduation and a post graduation from Government Medical College Nagpur, that was somewhere in 77 we did MD, and 78, 79 we were doing medical fellowship, lecturership. And that time we were just thinking that should we be doing a post graduation or the super specialization. The trend wasn't that much, but I thought that it would be better to have a super specialization in a longer run, because the field of medicine is so vast that it is difficult to get specialized in an individual subject unless until you have a knowledge about it. So I when I did my DM, I was the 21st DM throughout India, and now there must be more than 4 to 5,000 DMs and DNB gastroenterologist fellows. So there is a story behind it. After doing MD in medicine, the train was to go for cardiology. So
yeah.
we had a chance to go to Chandigarh, uh, in PGI Chandigarh, and we wanted to see the institute. We were highly impressed by the institute. And then we had a desire to meet Dr. Professor Bidwai, who was a professor of cardiology. So
Okay.
what we went to his home and discussed with him. He said, "Why don't you go for some new branches like gastroenterology, endocrinology? Why do you?" So that affected, that had struck my mind, and I continued having tried for gastroenterology. The first time I couldn't succeed, but subsequently I could get entrance into PGI Chandigarh. I would still tell you that at that time, people from South in If somebody is from Andhra, there will be 10 people staying in his room. So the trend had started in the south, but was not that prevalent in center part of the Maharashtra and in Maharashtra, I would say. So
Yeah,
that is how I entered into gastroenterology profession. And
I must say. So that's yeah.
I must thank Dr. Bidwai because it is such a good branch. I love my branch.
I'm really very happy to hear that because, especially for some people like me, trying something new and it's very scary. It sounds very scary, and not everyone has the capacity to try something that no one else has. So
In
that's
fact,
a
I must
very
tell you
yeah,
that during the second time when I got entrance, I got an admission as in the cardiology in KM hospital and gastroenterology in PGI. So I preferred to
okay,
have a gastroenterology in PGI than having a cardiology in KM under Dr. Pinto. That was the time Dr. Pinto was there in the KM. So I preferred, and that was good, I suppose so.
yes. And so, talking about this, your experience as a gastroenterologist, what are some of the daily challenges that you have to face, or any gastroenterologist has to face, and your advice to them?
See, basically, the biggest challenge was to establish gastroenterology as a branch. Initial few days, when we are asking the patient to do an endoscopy, out of 10 patients, one or two would do an endoscopy and the rest would refuse out of fear or out of not knowledge, and the endoscopy was not prevalent. People used to go and do the barium examination and bring us the films and show that we have got this. So the
Yeah.
first was to establish the importance of gastroenterology. And after a decade of our hard work, subsequently, people used to come to ourselves saying that we want an endoscopic examination. Then we had to tell them that this is not required for you. But still, they had the endoscopy, the importance of endoscopy had grown so much that people, they themselves wanted that we should have an endoscopic examination. So that was the first. The second was, for any practitioner to sort of develop, we have to develop a brand. That's a challenge. So it is now no longer Dr. Shrikant Mukewar. It is a Midas, which is in an individual's name. And building a
Yeah.
brand requires lot of hard work, and the brand stays there for quite a long time. The people will come, join, and the hospital name would flourish. So, as an
Yes.
individual, our biggest challenge was to bring a brand from Shrikant Mukewar to Midas. So, that was the biggest challenge. And the third biggest challenge, which in in our always in our speciality, is to update yourself with the knowledge. The knowledge is so vast. Now we have several fields in gastroenterology. We have endoscopy, so some people are specialized in advanced endoscopy, some people are specialized in liver, some
Yeah.
people are specialized in IBD. So for a practitioner like me, I always call myself as a general practitioner in gastroenterology because I have to look after everything and to keep update. This is also a greatest challenge. The fourth challenge, which I would say, is people, they come from a long distance with us. 70 to 80% of our daily patients, they don't take any appointment. They come of their own, empty stomach, get their test done. Even if you tell them that you have an heart attack, you want to get hospitalized, they would say no. We have to go, we will go home and then come again. So that sort of psyche is there. So our biggest challenge is to finish off the investigations of all those patients and send them back home the whole day. So in a OPD of more than 100, I would say that 95% of the people, they go back home doing all their investigation, getting their diagnosis, and getting their counseling and the prescriptions and so on and so forth. And
Yes.
another challenge is to do the complex procedures without having complications. So that's another challenge, because all these procedures what we do, like ERCPs, endoscopic ultrasound, therapeutic, are associated with some of the other complications. So even if you tell the patients that these are the complications, whenever there is risk to the life or the complications, then what happens is the patient's relation, somehow they don't take it even after counseling. So getting those procedures done properly and making it more successful makes it's a teamwork. Your technician should be good, your radiologist should be good, your anesthetist should be good. So building a team is also a very important aspect of our success.
I must
And
say, sir,
then
it sounds a yeah,
this challenge is to give time to your family members. I must
yeah.
say that I'm so happy that my wife is not that demanding, but giving that's the greatest challenge which we face.
I must say, sir,
And
and it sounds very tough.
to yourself, because you don't get time to have your extra curricular activities and your hobbies. You don't time to nurture your music and other things. That's a challenge.
And so, the extracurricular point got me a little curious. So, in your life, how do you balance your family, your work, and the extracurricular things that you have? Because I believe it also, extracurricular activities also keep one interested in what they are doing side by side. So, how do you maneuver all of this?
See, I must say that doctors are really a talented group. Those who are very, they have love for music, they have love for various activities. I must quote here the example of one of my very close friends, Dr. Kulvinder Dua, who
Yeah,
who is a gastroenterologist from Milwaukee, and he has flied the MiG aircraft. So you have such hobbies of flying the aircraft and music, dance, entertainment, telling so much, painting, and so on and so forth.
yeah.
So we have a very vibrant musical group in our IMA, those who are like professional singers. So they would find some time for themselves and try and develop that hobby.
Yeah, I must say, sir, at as tough and challenging as this sounds, it also gives the person a sense of satisfaction and
Yeah,
the
but
peace
at
of that
times,
you're doing something noble.
busy.
Yeah,
So busy that weekends are not there. Sometimes 4 and 5 weekends are blocked. Here you have to deliver a lecture. Here we have to attend a conference, and to develop your your practice, your aim, your goal. You have to do hard work. Sometimes I
yeah,
really miss having spent not spending sufficient time with our grandchildren who are there now. Our grandchildren are there on the holidays, and I personally doesn't get much time to spend. So that's at the back of my mind. That's that's a negative point, but uh, over now, because I'm busy. This is happening
yes.
over a period of time. Probably when I retired, I don't know when. Probably that's a time when I will spend time.
Yes, sir. And taking this conversation a little forward and looking at it from a broad perspective, you have been in the medical field for over 4 decades now. So, what
Yeah.
changes and new innovations do you see in the medical field that was earlier during 1980s, 1990s to now? What do you miss? What are the main significant changes that you have witnessed?
Yeah, in fact, the changes are in all the fields, and the electronic digital media has come a long and big way. I must tell you from a gastroenterology perspective that fiber optic endoscopy was there. Fiber optic means we used to see with your eyes inside. Nobody
Yeah.
else was able to see, and that is how we learned the endoscopy, because then our professor used to give us there was a scope which is called as leptoscope, and that was attached. So with that we were having a vision, but that vision was very ill defined and not very clear. Subsequently, the biggest change came when the fiber optic was converted into video endoscopy. So with the video endoscopy, you could see on the screen 10 people used to see, and that was very important for procedures like ERCP. ERCP is a procedure wherein we put the endoscope in the second part of the duodenum, and through the bile duct orifice, which is opening into the duodenum, which is like a eye of a needle, we put in a wire, cut the sphincter, and remove the stone or put the stents. So these very minute procedures, they require a hand-eye coordination. So your
Yeah.
assistant, if he can see, he can help you better. So from the greatest was from fiber optic endoscopy to video
Hmm.
endoscopy. Then was a therapeutic endoscopy. That means you have bleeding, you block the bleeding vessel and stop the bleeding. So you are not doing diagnosing, but you are treating the patient. If you have a cancer patient, you put the stent and relieve his dysphagia, swallowing difficulty. Then then came the with this therapeutic. Then came the EUS. EUS is a sonography machine attached to the endoscopy machine, and with this you could see outside the wall of GI tract. So with
Yeah.
this outside the wall, so you can see the liver from stomach, you can see the pancreas, you can see the spleen and the lymph nodes, and you can take a biopsy, you can drain the bile duct. So in a patient with jaundice, obstructive jaundice. So then EUS, and then the therapeutic EUS. Therapeutic EUS is puncturing the bile duct, puncturing the pancreatic duct, and getting patients' problem relieved as you do with ERCP. And some patients ERCP is not possible, you are not able to do. So that was a EUS. So I started with fiber optic endoscopy, then was a video endoscopy, then was a therapeutic endoscopy, then was a EUS, and now for the last decade there
Yeah.
is what is called as a third space endoscopy. Third space
Okay.
means with the help of endoscope, you can go into the wall of the GI tract and cut the muscles. And like patients who have motility disorders, which are called as achalasia, you can do what is called as POEM. POEM is per oral endoscopic myotomy. So, with the help of creating a tunnel in the wall of the esophagus, with the help of endoscope, cutting the muscle, and doing entire surgery by endoscopy is what is defined as POEM. So, That's development of third space endoscopy. And then I would say that artificial intelligence. Artificial intelligence is coming everywhere. So same, it is coming in all the fields in gastroenterology. Now we have the scopes which are enabled with artificial intelligence. So what they would tell you that you are seeing a polyp. Polyp is muscle. Non-malignant muscular growth type of thing, and
Yeah.
this polyp, whether it is cancerous or non-cancerous, can also be told by the artificial intelligence. And the artificial intelligence, they dictate the reports that this is the size of the polyp. So you don't have to dictate the reports. So that is how, and the artificial intelligence is a smart that they accumulate all the information, and then they go on like their memory and go on improving upon their diagnosis. So AI,
Yeah.
artificial intelligence, is coming in big way in hepatology, in gastroenterology, and everywhere. So I think the journey, and now when you want to send the images, you have WhatsApp. We suppose we remove the stone from the bile duct, and I want to communicate to one of my doctors who have referred. What I do is I take a video, send it by WhatsApp. Initially, in the earlier days, we used to write a letter, and that used to reach him by 4 days. There was no question of sending videos and other things. So, with the electronic media, you become very fast in sending the messages across.
So, sir,
So,
do you
that's
miss the earlier procedures, like the earlier how the medical field was, or would you rather stay in the present times and enjoy all these technological advancements?
yeah. In fact, the all these technological advances are so great. In fact, in cardiology, I would say that they have catheters which are designed to go into the left artery, right artery, or circumflex artery. So they have those angles made. So the stents made. They have also what is that called as a drilling machine type of thing, which drills the atheromatous plaque. So in each field there are advances. The laser have come. With the help of laser, we can blast the stones in the bile duct and the pancreatic duct, and thereby the surgery can be avoided in majority of the patients wherever we want to.
That's very fascinating, I must say. And so, I was talking to one of the, yeah.
Gastroenterology is very fascinating, I must say that.
Yes, it sounds also very interesting. I'm very
Yeah.
intrigued by all of this, I must say. And sir, taking this conversation a little forward, earlier I was talking to one of the other doctors, and they told me that medicine, the medical field earlier was about trial and error. You are doing something, you may succeed, you may not. Then but now it is about having a go at it, just like there's always there is uncertainty in this profession, but now doctors don't think as much as they did earlier. So how much of it is true? I wanted a little clarity on that.
See, presently AI has come into the procedures. AI has come into the algorithms for managing liver failure patients. But the clinical things are at present are the dominant things, and that is how one differentiates one doctor from the other. If they become universal, probably we would be you will be like like the fighter, like air journey. The air journey is so safe now. So we want, as our profession, to be like a person sitting in the flight. He is almost
Yeah,
assured that he is going to go home. But then there are certain circumstances which are beyond human control. That the
of
diseases are
course.
such. Yeah, if you have um, three organ failure, then the
Mm.
statistically the chances of your dying are more than 70%, whether you are in states, whether you are in India, whether you are in any part of the globe. So what I mean is that the sometimes the diseases are so advanced that you have an advanced cancer, then you cannot do anything. So that is how, is the problem in medical profession.
Makes sense, sir. I think that's a very apt clarification on this
Yeah.
argument that was presented. Yes. And so now, when we are talking about technology and medicine, we know that technology has improved the medical field and the medicine. And now that we have a thing called as virtual care, where people can, interact with doctors virtually, and they can also prescribe the patient's medicines and the treatment plan, everything. So, what do you think about this virtual care? What are the drawbacks of this? New system that we have, and to what extent is it beneficial for all the patients?
See, what I would say is COVID has taught us many new things. We were not, prior to COVID, we were touching all the patients. And
Yeah.
the patients would themselves say that, डॉक्टर साहब आप हमारा पेट देखेंगे, हमको सेटिस्फैक्शन नहीं होगा, पेट को हाथ लगाएंगे. Post
Hmm.
COVID, I hardly get a patient who would say that, touch my abdomen. So the mindset of people have also changed. And the biggest gain of the COVID, or the biggest advantage of the COVID, what I thought, is this online. Otherwise, these online things were not that prevalent. Otherwise, you would have asked me to come to the studio of 10 News uh, and give the interview. This was never
Yes.
prevalent that time. And in fact, with the technology advances, you are sitting in the home giving the interview. So, same is true about the patients. I personally not very comfortable doing the first consultation with the patient online consultation. I normally would prefer, I mean, I have seen the patients and the patient wants to consult me again. Then probably I would certainly be happy to give my services online. But when the
Of course,
patient
because
comes first
yeah.
time, he has to get a diagnosis, and diagnosis means he has to get the investigations, and the investigations have to be done at a place where you feel that this is reliable. If you don't feel the reliability of the lab, the reliability, so that is my main concern. If I have a control over the lab in the other places, then I would not mind if I have some branch in Jabalpur and the patient goes there. I knows the standard, and then getting these investigation and consult would not be
Yes.
a problem. But getting the investigation at other places, and that's always a problem.
Yes, and you just said, sir, that the first consultation should cannot always be online, and that is very logical also, because
Yeah.
at that the doctor gets a a sense of what the patient is feeling, how they are reacting, behavior, and things like that. I think that is very important as
I'll
well.
give you an example.
Yes.
Patients, they come to us with the reports. The reports, they bring the reports, and the reports sometimes they don't mention what is the patient's consciousness and other things, the details. And looking at the reports, we say that, oh, he's very serious. And when the patient actually comes, he comes walking to us. So there is a disparity between the reports and the patient's condition. So I would
Yeah.
always, given a choice, I would recommend that the first consultation should be with me.
Yes, sir. That's very
Subsequent,
logical as well. Yeah. Yes. And so now that we have talked about the changes in the mentality of patients, the changes in the medical profession, what are your thoughts on the changes in the medical education? How was it earlier and how is it now? Can you comment on that?
yeah, I feel that uh, not only medical education, I would say that in the primary education, now my grandson is in the first standard. And I was talking to the principal, and she was saying that we are going to introduce artificial intelligence in the school. So
What?
the artificial intelligence in the school, they are going to introduce from the first, second standard. You imagine the situation that these younger people are exposed so much. Our time, the anatomy was like a dissection of the body and the muscles, and we used to see at the atlas and see. Now there is a CT scan, the CT scan. So on the CT scan, they would say and show you that these are all the muscles. So there is a tremendous change in the medical education also. So apart from that, now there are videos. If you want to learn a procedure, there are videos of that procedure available on the YouTube. You see it 10 times and see how it's being done. Earlier, we used to go spend time with the expert, spend 8 or 10 days, and if
Yeah.
there is a procedure, we will see, otherwise not. But now it has become very easy. So I think the advancement is in all the fields. The clarity of the image, the cameras, and the digital platform makes it so live, as if you're seeing better than what you see by most of the ordinary scopes. The conferences you see, the images are so nice. They are much, much better than what you actually see by the ordinary scope. So that those are all the big changes which has happened, not only in the
Yeah.
medical field but also in the other field, the uh, camera field, the electronic field, and other things.
Yes, and I just want to add that as much as fascinating and interesting this advancement sounds, it also is very terrifying at the same time because having AI at a school for class 1 and class 2 children than,
Yeah,
studying a procedure online is very scary, I must say. I'm hats off to
I
people who
think
have to deal with this.
it has advantage, disadvantages, but I think taken in a proper perspective, it will definitely have more advantages than disadvantages. Like we do a procedure, we tell them the patient the complications. The 100
Yeah.
out of 100, 4 would have complication. That does not mean that because of the complication that we should not be benefiting the 96 others, those who
Yes.
should have been benefited. So there is
Yeah.
always a risk and the disadvantage downside of everything, which you have to understand.
True. Yes. And so we'll cut this conversation a little short due to time constraints. Towards the end, I want to ask you what would be your message to all the young and aspiring doctors and the medical professionals out there?
See, nowadays, people, they want everything very quick. They want quick money. They want quick establishment. Within second year of practice, they want a car, four-wheeler, and they want to establish, get the house, and So, my message to all the younger generation is have patience, be truthful to your patients, never indulge in the bad things, especially the kickbacks and other things, the focus on the patient, think that this patient is your own relative, and would you like to do such type of investigations? Say that there is a lady who comes and you feel that she is your mother, would you like to do the same sort of investigations on her? If you consider from that point of view, and you have to be, because of medical profession, have to be humanitarian. Suppose somebody does not have any finances, probably you have to treat that patient, and not, you should not reject for the lack of money. And the other thing is, there is always when I study these, there is always a conflict between the patients and the doctors, for the reason that the doctors, they don't explain the patients about the condition properly because of the busy time, or there is a gap in explaining. So that communication gap has to be certainly avoided, and they should stick with the relation. Now there is a era where you should have a video recording of all this, because what happens is patients have 100 relations, and they would come and tell you that you speak to my kaka, auntie and aunt and uncle and so on. So,
Yeah,
and then there's some political person comes that I want to talk to a doctor. A doctor has 100 patients. How can he talk about each patient 2 or 3 times in a day? It's not possible. So
true.
the
Yes.
political person gets insulted, and then he creates a problem. So, I mean, that should be the thing, that you be with the patient, be friendly with the patient, study properly. You must know your subject properly. Don't go for easy and early money, and don't go behind money. The money will follow, and you must be truthful and faithful to your patient.
Very well said, sir. I must say, and that's a very inspiring and encouraging piece of advice that you have there. Thank you so
Yeah,
much. And I must say, it was quite a pleasure interviewing you, because
yeah.
after
In fact,
talking to you, yeah,
I
the
must.
only thought, yeah,
Sorry. Yeah. Go ahead. Go ahead.
please continue, sir. Okay. Sir, I was saying
And
that after talking to you, the only thought that comes to my mind is the best is yet to come, because we all are always, wanting more, want a lot of things in our lives, and the beauty of medicine is that there's always room for improvement and new knowledge. While we're talking
yeah.
about the evolution of medical field as well.
No,
Yes.
in fact, I must say that this is the first live interval without any questions being given. So that has boosted my confidence also. So, in fact, I was little apprehension. I had little apprehension that I don't have questions. How can I answer the questions? So, but then, I think whatever happens spontaneously is always good. So I must thank
Yes.
the 10 News for giving me the opportunity also. Because nowadays, what happens is, after 40 years of practice, everybody is calling you chief guest here, felicitating you on the news. So that there is epidemic of this. So, but then this is the first live interview without any questions being told to me. So I really enjoyed it. Thanks, 10 News again.
You're most welcome, sir, and thank you so much for coming to our channel. And to all our dear viewers out there, we hope that you really like this conversation with our special guest, and we are indeed excited for the next episode. Thank you so much.
Thank you. It's done.
Yes, sir. We can leave. Thank you.
Thank you. Thank you. Nice questions, and I must appreciate you asking them. How was it?
It was good, sir. We first need to leave the studio, so it's still live.
I know, I know.
And I must say, sir, when we are talking about this medical field and this, this industry, it is yes.